For those of you that don't know me, my name is Lisa Rennie. I work as a local GP. I stand here this evening as a doctor, as a mother, but mostly as a human being wondering what has happened to basic humanity. What we are witnessing in Palestine must be acknowledged, and this safe space is an important opportunity for reflection, discussion, and hopefully action. It's a great opportunity for like-hearted people to meet and connect this evening, so please talk to one another and engage. It's important to highlight that this is a private event. It disappointingly has nothing to do with the NHS. All voices and opinions this evening are personal and do not represent NHS Highland. It's an absolute honour to have so many exceptional speakers here this evening. We're so lucky to have these compassionate health workers within our community. Before we hear their stories, it is crucial we talk about the suffering of our colleagues working in Gaza and what they've endured relentlessly for 9 months. They're exhausted. They're asking for our help. Health workers have been targeted and detained and tortured. 507 health workers have been killed and 670 injured. They're hungry and do not have colleagues to hand over to. They have had family killed. They've amputated their own child's leg with no analgesia. They're filming at work to document war crimes. Their stories are not being told by Western media and they must be heard. 32 hospitals, 110 clinics, and 239 ambulances have been destroyed. We've lit a candle in memory to our fellow health workers who have been killed in Gaza. These are people like you and I that get up and go to work to help other people every day. They have careers, families, and dreams. They must not be forgotten. Israel's targeting of health workers and services is intentional, as it adds to Palestinian suffering and attempts to sabotage their incredible success. We must also recognise that suffering in Palestine has been going on for 75 years. Palestinians live under occupation and apartheid. Healthcare restriction is included in their daily oppression. What enters and leaves Gaza is controlled by Israel, their occupier. The repeated and persistent psychological trauma of those living in Gaza is utterly unimaginable. The physical and mental health implications will last a lifetime and also be inherited by future generations. Many of you will have seen the Lancet article published on July the 5th, which highlighted that the number of deaths that we see reported in mainstream media are likely an underestimate. Aside from the direct harm from violence, the direct death rate is likely greater. Think of the disease, malnutrition, lack of healthcare, and implications in reproductive health. Humanitarian aid, including medical supplies, is being blocked by Israel. This Lancet article suggested that the number of deaths is likely far closer to 186,000 people. That's 7.9% of the Gaza population. To put that in perspective, the equivalent in Scotland would be 380,562 people killed. Just let that sink in. We know that over 15,000 children have been killed. This is not a war with collateral damage. There is no doubt this is genocide we're witnessing. Here are some questions for us to consider as we move through the evening. As health workers, do we have a duty to promote health equality globally as well as locally? Are health workers in Palestine not our colleagues? As human beings, are we not all connected? Do we recognise our own privilege, our safety, our human rights, our access to healthcare? How do our ethical principles of beneficence, doing good, non-maleficence, do no harm, autonomy, freedom to choose, and justice, ensuring fairness, apply in what we do for Palestine? As adults, do we not have a responsibility to advocate for children's human rights worldwide?